Welcome back to the channel where medical topics are made simple. In this video, we're going to talk about the signs and symptoms of a subarachnoid hemorrhage. This video includes memory tricks, so make sure to watch the entire video. You can find this topic in our book and follow along, which is linked down below. You can also find the notes for this video linked down below. In our previous video, we talked about what a subarachnoid hemorrhage is. As a quick reminder, a subarachnoid hemorrhage is bleeding in the subarachnoid space surrounding the brain. Oftentimes, the bleeding is from a ruptured brain aneurysm. A ruptured brain aneurysm is the most common cause of a non-traumatic subarachnoid hemorrhage. In our previous video, we talked about where the subarachnoid space is. There are three protective layers of membranes that cover the brain, called the meninges. From outer to inner, they include the dura mater, arachnoid mater, and pia mater. The subarachnoid space is located between the arachnoid mater and pia mater, and the subarachnoid space is where the bleeding from a subarachnoid hemorrhage occurs. Now that we know what a subarachnoid hemorrhage is, what are the symptoms? The first symptom is headache, and there are two main buzzwords you need to know. This is important, so listen up. You'll see this on your exams. The first buzzword is thunderclap headache. If you see thunderclap headache, think of a subarachnoid hemorrhage. A thunderclap headache is severe explosive head pain. The pain typically reaches maximum intensity almost instantly, like a clap of thunder. It typically peaks in 60 seconds or less, and it's often described as the worst headache of their life. This brings us to the second buzzword. Another common buzzword on exams is worst headache of life. If you see this, think subarachnoid hemorrhage. A subarachnoid hemorrhage typically causes a headache that is the worst anyone has experienced in their life. So again, thunderclap headache and worst headache of life, think subarachnoid hemorrhage. These are popular buzzwords on exams. The next group of symptoms to know are meningeal signs or symptoms. Remember we said a subarachnoid hemorrhage is bleeding in the subarachnoid space. We also said the subarachnoid space is located within the meninges. So bleeding in the subarachnoid space can irritate the meninges. The irritation of the meninges is what creates the meningeal signs or symptoms. These include photophobia, which is sensitivity or intolerance to light, nausea and vomiting, neck pain, and nuchal rigidity, which is neck stiffness. The patient has a hard time touching their chin to their chest, and there's resistance to passive stretch. There are two physical exam tests that can be done to check for meningeal irritation. Let's look at those now. This is important, so listen up. You need to know this for your exams. There are two tests on physical exam that can check for meningeal irritation, Brudzinski sign and Kernig sign. We're going to give you a memory trick to remember each one, so keep watching. The first test is called Brudzinski sign. A positive Brudzinski sign is when the patient brings their knees in when the neck is passively flexed. The memory trick for this is to take the BR at the beginning of Brudzinski to remember the word bring. Bring starts with BR, and then take the KI at the end of the word Brudzinski to stand for knees in. This will help you remember the phrase bring knees in. This is because passive neck flexion causes the patient to flex their hips and knees or bring their knees in. And this sign makes sense with subarachnoid hemorrhage. What happens with Brudzinski's sign is that the meninges are stretched when the neck is flexed. And remember, a subarachnoid hemorrhage can cause the meninges to be inflamed and irritated. So when the meninges are stretched, this causes the patient to bring their knees in to relieve pain. The second sign is Kernig sign. A positive Kernig sign is when the patient has spinal pain or resistance when the knees are passively extended. The memory trick for this is to take the KE at the beginning of Kernig to remember the phrase knee extension. This is because there is spinal pain or resistance with passive extension of the knee when the hip and knee are in a flexed position of 90 degrees. In other words, the patient is supine and their hips and knees are flexed 90 degrees, and when the knees are passively extended, it causes spinal pain or resistance. And this sign makes sense with subarachnoid hemorrhage. With Kernig sign, the irritated meninges and nerve roots are stretched when the knee is extended, and this causes spinal pain or resistance. The next group of symptoms involve increased pressure in the skull. A subarachnoid hemorrhage can cause the pressure in the skull to rise. This is known as increased intracranial pressure or ICP. When blood enters the subarachnoid space around the brain, it has several effects. Remember we said in the previous video, the subarachnoid space contains cerebrospinal fluid, or CSF. Well, when there's blood in the subarachnoid space from a subarachnoid hemorrhage, it can disrupt the normal flow and drainage of the CSF. This can lead to fluid buildup known as hydrocephalus. The bleeding from a subarachnoid hemorrhage can also decrease the oxygen delivered to the brain. This, along with the bleeding itself, can cause brain swelling called cerebral edema. The blood also takes up more space in the skull and adds extra mass. This is called mass effect. The hydrocephalus, cerebral edema, and mass effect, among other factors, can all increase the pressure inside the skull, called increased intracranial pressure. The increased pressure can decrease blood and oxygen supply to the brain even more. So what are the symptoms of increased ICP? Let's look at those next. This is important, so listen up. You need to know Cushing's Triad for your exams. Cushing's Triad is a set of 3 signs that indicate increased intracranial pressure. The first is a high systolic blood pressure with the widened pulse pressure, meaning a large gap between the top systolic number and the bottom diastolic number. The second is slow heart rate, called bradycardia. And the third is irregular breathing. Abnormal breathing patterns may include slow deep breaths or gasping, or Shane-Stokes breathing, which is cyclical episodes of apnea where breathing stops, and hyperventilation where breathing is fast and deep. Other signs of increased intracranial pressure include nausea and vomiting and cranial nerve deficits. This may include a fixed, dilated pupil, sometimes referred to as a blown pupil, ptosis, which is drooping of the upper eyelid, or various eye gaze weaknesses or the eye turning inward. Since we're talking about cranial nerve deficits, a subarachnoid hemorrhage can also cause stroke symptoms. Let's look at that next. In our previous video, we talked about how a subarachnoid hemorrhage is a type of hemorrhagic stroke, which is a stroke caused by bleeding in or around the brain. The bleeding itself and the increased intracranial pressure we talked about can decrease oxygen delivered to the brain, which can lead to stroke symptoms. This may include focal numbness, weakness to one side of the face or body, changes to vision, such as double vision, slurred speech, called dysarthria, or trouble understanding and finding words, called aphasia, to name a few. A subarachnoid hemorrhage can also cause seizures. The bleeding in the subarachnoid space around the brain can irritate neural tissue, decrease oxygen to the brain, and trigger inflammation. All of these factors can disrupt normal electrical activity in the brain, and this can cause neurons to fire in a hyperexcitable way, and this can lead to seizures. A subarachnoid hemorrhage can also cause a decrease or loss of consciousness. The bleeding, irritation to the brain, and increased intracranial pressure, among other factors, can all lead to altered mental status or loss of consciousness. This can range from confusion to fainting to a deep coma. So if we bring all the symptoms together, they include headache, which is often described as a thunderclap headache or worst headache of life, meningeal signs, including photophobia, nausea, vomiting, neck pain, and nuchal rigidity. This may lead to a positive Brudzinski's or Kernig sign. There may also be signs of increased intracranial pressure, which may include Cushing's Triad of high systolic blood pressure and widened pulse pressure, bradycardia or slow heart rate, and irregular breathing. There may also be signs of cranial nerve deficits and other stroke-like symptoms such as weakness, numbness, and slurred speech. Other symptoms include seizures and altered mental status or loss of consciousness. We're going to talk about the diagnosis and treatment in the next video, so make sure to watch it. It's linked down below. If you found the video useful, please hit that like button and let us know in the comments. You can find the notes for this video, along with our book and flashcards linked down below. Subscribe to save time studying and not miss out on future videos and notes. Thanks for watching, and hope you return for future videos.